Mko tayari? Good afternoon. Tuanze. Mnaona distance ile tuko 1 meter each mbali hivyo ndio inatakikana. Hata nyinyi kuketi vile mmeketi ni sawa. Lakini vile mmesimama hapo pale mko crowded. Nitaissue the official press statement from the Council of Governors. Thereafter, my colleagues who are here, I will also give them a chance just to make a comment, 1 or 2, so that we are all reading on the same page.
Good? Okay.
Thank you very much, members of the Fourth Estate, for coming for this press statement from the Council of Governors on preparedness of counties for the COVID-19. We want also to thank the President for showing leadership in the country's response towards the coronavirus. We also thank the county governments for putting up efforts to address the COVID-19. We are confident that the ongoing processes will deliver positive results with adequate support from the National Ministry of Health and Development partners. Despite the measures undertaken up to this moment, county governments continue to face myriad of challenges as follows. 1. Inadequate personal protection equipment, which they call PPE. All 47 counties in total have received only 2,805 PPEs, kits, instead of the proposed 305,000. Thus not even 10% of what we require. This poses a serious challenge and vulnerability of health workers in their response. We urge the national government, through the CS in charge of health, Mr. Mutahi Kagwe, to take up this matter seriously to ensure the counties acquire enough stock to help contain the virus. With also neighboring countries confirming cases of COVID-19, border counties need to be classified among the high-risk counties for heightened surveillance because of their proximity with the affected countries. We had 14 counties which had been classified as high-risk areas, but with now COVID in other neighboring countries, all counties that are neighboring these countries should be classified under high risk, so that they also get close surveillance and also get necessary equipment. Number 2, the diagnostic laboratory services. Currently, there are only 2 laboratories at the national level, at Kemri and Nairobi Influenza Laboratory are able to test the virus. Only 2 in the country. County lab personnel so far have been trained, but not equipped to collect specimens. This is in itself is a great risk for the country should the disease spread rapidly in many counties at the same time. Long turnaround time for sample collection and testing is not good for the response. We therefore recommend that national government urgently equip all level 4 and 5 facilities to be able to collect and test samples for the virus, and also train more lab personnel. Better still, all counties need to have testing centers. Number 3, training of health workers. The training of trainers of frontline case management healthcare workers started on Tuesday and will end on Friday this week. Each county has been represented by only 1 healthcare worker, and therefore leaving a big gap. We therefore request that more health workers should be trained urgently to increase that number. This being the end of financial year, this is now on budget allocation, financial implication. This being the near end of financial year, counties have no budget in the emergency vote, and therefore the national government has to allocate resources to counties, this being a national disaster. We also ask all the counties on our part to try and allocate emergency funds where those votes have been exhausted. Number 5, economic impact to the country of the COVID-19. There is need for sober discussion on the economic impact of the coronavirus epidemic in Kenya. Therefore, as a Council of Governors, we urge the President to convene a meeting that involve all relevant stakeholders, including governors, to strategize on how to mitigate the economic effect of COVID-19. At times like this, we should all be able to work together for the sake of our people and our country. Finally, we urge all members of the public to remain vigilant as the risk is still high, and to continue to take precautionary measures such as maintaining basic hand and respiratory hygiene, safe food handling practices, and avoid close contact with people. Members of the public are also encouraged to avoid public gatherings like funerals and weddings. And that's what I heard today. And ladies and gentlemen, before I give you a chance to ask your questions, I want to give my friends here just to make comments, starting from Governor Kajiado. Thank you.
Thank you, Chairman, and members of the Fourth Estate. As we are all aware, the world and our country and our counties are facing a very difficult time out of this pandemic. The most important thing for now is the dissemination of correct information with regard to the pandemic, which as counties we will endeavor to disseminate the information correctly. The role of medical personnel will be very, very critical, because this is fairly scientific, and we are also aware that there is going to be a lot of information from the social media that can mislead the public and give the false information, and sometimes allege or finding solutions to the problem. So dissemination of correct information remains paramount, and the counties using their medical department will go out of the way. So we urge the public to use the correct channels as much as possible so that they are not misled in the fight of this pandemic. By individuals protecting themselves, their families, it will go a long way to protect our counties, our country, and contribute to the well-being of our world. And so we are here as governors to participate in disseminating this information and in playing a critical role to make sure that we are safe as individuals, our communities are safe, our country is safe, and our world is safe. Asanteni sana. Thank you.
Governor Bungoma.
Thank you, Chairman, and ladies and gentlemen. I think first and foremost, just to echo the sentiments of our chair, we want to appreciate the President for the leadership that he has shown in these circumstances. Secondly, I think when you look at what has happened in other countries, be it in Italy, in China, in South Korea, the next 2 weeks for us as a country are very important. We are on week 2. Next week we'll be on week 3. Then thereafter on week 4. What happened in Italy is that the week 1 we had about like 2 or 3 cases. The second week it rose to about like 10. Third week it went to 300. Fourth week it was in thousands. So we are at a very, very critical stage as a country. It's important that we see what happens going forward, and we must as a country align ourselves with the guidelines of the Ministry of Health. Thirdly, and more importantly, what the chairman has mentioned is that we're asking the national government to decentralize the testing because one of the biggest problems we have seen across the world is that unless we are able to test many people as we can, we will not manage this virus. So I think the national government, as the chairman has mentioned, needs to decentralize this issue of testing so that I think every region has a lab that is able to test and tell us as counties that these are positive or negative or whatever it is. Lastly, I also want to appreciate the President, and I think just to add to what the chairman has mentioned, this morning has had a meeting with the leadership of the banking sector. I think we have, or we must have a meeting with all the stakeholders who run the economy of this country and discuss the economic impact going forward of this virus. This is because it's going to be massive on the economy of this country. Asanteni sana.
Thank you, Chairman. I want to take this opportunity to thank His Excellency the President for his leadership and also the 190 throughout the country. I'll give an example of Embu, where we got 4 residents who have been staying overseas, 3 in UK and 1 in Holland or Netherlands. If it was not because of the alertness of the people in the villages, they would have gone there and invited people all over the place. But we were able to contain the 4 very fast. Unfortunately, we were not able to test them because the testing is centralized. So I reiterate what the chairman has said. We must have testing centers starting with level 5, then level 4s in that order. Number 2, the kits which were distributed, I think they are short in terms of the booths. Instead of 25 booths, we only got 5. It's critical we get the remaining 20 so that our health personnel can do the work they are doing. And I commend them so far. Asante sana.
Governor Machakos.
Asante sana, nitaongea kwa lugha ya Kiswahili. Ningependa kumshukuru pia rais wetu Uhuru Kenyatta, amesema kwamba tuvute pamoja kama nchi. Wakati huu sio wakati wa siasa, sio wakati wa kujipendekeza, sio wakati wa kuzunguka na mambo ambayo hayafai, ni wakati wa kulinda watu wetu. Kwa hivyo namuunga mkono rais wetu kusema kwamba tuvute pamoja kama nchi, tukae pamoja, tufikiri pamoja, tufanye kazi ambayo inafaa kabisa. Jambo la pili ni kusema kwamba nchi yetu sio nchi ya matajiri peke yake, ni ya matajiri na maskini. Ni ya matajiri na wale wana pesa na wale wengine wanatafuta pesa. Kwa hivyo tushirikiane na tusaidiane kama nchi na tujue ya kwamba ugonjwa huu ni wa kila mtu, haujui tajiri, haujui maskini, na tuko hapa Kenya, lazima tutibiwe na tuwe na sera ambazo zinafaa. Ndio naunga mkono kabisa vile tumesema ya kwamba hizi testing centers, tuache mambo ya centralization ambayo tulikuwa nayo kutoka tupate uhuru, ambao tunaona bado devolution kwanza ijaingia katika mioyo na system ya watu wengine wa national government. We always need to think about decentralized things. Kwa hivyo tumesema sisi tuko tayari. Kwa mfano Machakos tuko na lab, tuko na all the equipment ready ya kutest coronavirus. Tunangojea tu tukue accredited, tukue approved, and it is the same with other counties. Tuko tayari, we can start testing coronavirus tomorrow. Tunataka ingine ikue western, ingine ikue north, south. We cannot bring everything to Nairobi. Ingine nikimalizia ni kusema ya kwamba pesa ni kitu cha maana sana. We need money. Na president leo amekutana na banking sector, wakaongea about banking fees hapa na pale. Lakini tufikirie, what can the government do, national government, treasury, tusimamishe some projects, tusimamishe mipango ingine, tuweke pesa kando that we can cushion. Kuna biashara zinafungwa, kuna hoteli zinafungwa, kuna factories zinafungwa. How are those factories, how are they going to continue after this pandemic? Zingine zitafifia kabisa, watu watapoteza kazi. Kula Marekani, companies zinapewa pesa kama cushioning, wananchi wanapewa pesa. So we must be involved in a conversation and think outside the box, tuone ya kwamba how to take care of our businesses and our people. Rais wetu pia ameongea kuhusu watu waache kuhike prices. Ni jambo la maana. Na mimi naomba my colleagues hapa, mimi nikianza Machakos, biashara yoyote ambayo inaongeza prices za normal goods ama normal products zinazotakiwa kwa wakati huu kwa sababu ya coronavirus, tuta revoke license yao mara moja na tutafunga hiyo biashara. Hiyo tamaa yako, utaenda nyumbani bila kitu. Kwa hivyo tujunge maslahi ya wananchi, tuache kufuata pesa wakati mwingine na watu wanaweza kufariki. Kwa hivyo tufanye hivyo. Na mwisho, hii coronavirus ina affect sana wazee. Babu zetu, wazee wetu, wazazi wetu ambao ni wazee, tukiangalia historia kule China, Italy na wengine. Kwa hivyo mimi naomba wazee wetu, akina baba na mama ambao ni zaidi ya miaka 70-75, tukae nyumbani, tusitembelewe na watu wengi. Let's hang around at home. Tusianze kwenda sokoni, kuingia kwa magari na wengine, kwa sababu hao wakiambukizwa, chances zao za kuaga dunia ni haya kuliko za kijana akiambukizwa. Asante.
CS, come here. Yes.
Thank you very much. On behalf of national government, I want to thank the chairman and the Excellencies governors for working very closely with the president and my colleague CS in charge of health, CS Kagwe, in ensuring that we confront this new enemy called Corona. Now, this is an enemy that does not know any borders of any country or any county. That is why we need to work together with all our counties to ensure that we are able to confront this disease. It will take all of us working together, and I want to thank the governors. Many of them have already set up emergency centers in their level 4 and level 5 hospitals in all the counties across the country. This is very necessary in terms of preparedness to confront this, because it can happen anywhere, in any region in our country, in any county. In the US today, we're being told almost all the 50 states are affected. So all our 47 counties must be alert, we must all be vigilant, and we must all work together to ensure that we contain this disease. Thank you very much.
Okay, if you have any question, clarification, I think we have been more detailed on this issue, and we'll keep on briefing you as we move on. Yes?
Chairman, there are some questions that you've raised or inadequacies in terms of equipment and other materials. Is there maybe a budgetary allocation that you have made as governors, first of all, before you get those provisions from the national government? And now the CS is here, we respond on why there's such a delay and what they are doing as government because of collective responsibility.
At the county level, we have emergency funds. There is a provision in the Public Finance Management Act that at least 2% of our budget we set aside for emergency. And I've clearly said, as we approach the end of the financial year, those accounts or that vote, you'll find that it is stipulated. That's why I've requested my colleagues that if the account is stipulated, then they will need to do supplementary or do virement from other accounts. But this being a national disaster, counties cannot cope up. So we will need support definitely from the national government. Unfortunately, the KEMSA, which was supposed to supply non-pharmaceutical commodities, is not able to cope up. We send our people there to collect them, and that is our first line where we go for our commodities. So if they are there, and we have no advice from the national government where we should go, because they are in charge of standards, and that's what we are saying. Someone must wake up, someone is maybe sleeping on his job, to tell us where can we get this particular equipment. Because we have a responsibility as wananchi to protect ourselves, even at the county level. If the government, national government comes, at least it finds us somewhere. We can't